At the American College of Chest Physicians meeting here in Philadelphia, Dr. David Sachs of the Palo Alto Center for Pulmonary Disease Prevention said that nicotine dependence among patients seeking treatment for their addiction is at its highest point since 1989.
And what we did is looked at three separate cohorts, one from this first nicotine patch trial in 1989-1990, second from the bupropion FDA registration trial. We had 206 participants who were involved in our Palo Alto site. And then in 2005-2006, I was co-medical director with Dr. John Hodgkin of the St. Helena Center for Health's Center for Smoke-Free Life. This is a residential 8-day intensive treatment program. And I was struck by the fact when I was working with Dr. Hodgkin that these people were much more nicotine dependent as measured by the FTQ scale. What we showed is that indeed over the last 15 years there's been a steady increase in severity of nicotine dependence, and the data are clearly stated in the abstract, which I believe you have. The point I want to highlight is that in clinical practice today, anybody trying to treat tobacco dependence is going to have roughly 3/4 of those people falling into the high nicotine dependence group. If that physician or that person tries to use simple over-the-counter treatment, treatment will not be effective and they will rapidly relapse back to cigarette use. People who are highly nicotine dependent need much more intensive, individualized treatment to make certain that nicotine withdrawal symptoms are suppressed and stay suppressed. And that's the importance, I think, of this study, is that we are seeing a shift. Cigarette smokers today are physically more nicotine dependent, and it has nothing to do with willpower, whether or not they can stop smoking. It all depends on whether they get adequate treatment or not.
In Philadelphia, I'm Todd Neal, MedPage Today.